Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about reflexology. Years ago, I looked into reflexology, and I actually ordered a book and actually went through it, trying to figure out, does reflexology really work? Is it as effective, say, as acupuncture and some of those other techniques? And I had a hard time finding the science behind it that says, okay, this is working because of the science. Let me give you a little bit of background. Reflexology is basically designed through physical stimulation of the feet, the hands, or the ears to improve the functioning of an abnormal functioning organ, or to improve the homeostasis of the body through certain areas. As you look at this map here, we've actually got pretty significant. So this is the right foot over here. Let's make sure that we're actually ready to write on this. So this is the right foot on the right here. This is the left foot. Sorry. And basically what's happening is you've got all these areas on the foot that correlate with a certain area in the body. For example, you've got the spleen right here. You've got the ascending colon and ovaries, all that kind of stuff. So basically different areas of the foot. So you can say, okay, I'm going to stimulate the tip of the big toe, and that's going to affect the brain. I had a pretty big problem with this. I'm going, okay, I don't know that there's any science that says if I rub this area, it's going to affect the brain. If I rub this area, it's going to affect the spleen. If I rub this area, it's going to affect the ovaries or the intestine or the stomach or appendix or so forth. But they're starting to get more and more studies that actually show the beneficial effect. Whether it works the way they're saying it does or not is irrelevant. So really what it comes down to is what's going on, what's happening. So let me read a couple of them here to you. They've got studies showing that through this application of reflexology therapy, you may rectify the organ dysfunction and establish homeostasis. One study showed that you get an improvement of the quality of life in a cancer patient. Another study showed that you can reduce the pain and anxiety for patients with breast and lung cancer. Another one showed improvement in premenstrual syndrome, reduction in seizure frequency, improvement of quality of life in intractable epilepsy. And then they ran this study based on those findings to say, okay, does it work in diabetic peripheral neuropathy? The interesting thing they found through this study is they showed a significant improvement of the symptoms like pain, numbness, tingling, those kind of things in these patients over those that were in the control group. But they also showed documented things. So this is not just subjective changes. It's not just saying, okay, the pain is decreasing and so forth. They're actually showing an improvement of blood sugars. I mean, they had a over 30% improvement of fasting blood sugar, hemoglobin A1C, from the exact same treatments, including reflexology. So there's something to do with this. My theory here is that reflexology is a specialized form of massage that's improving blood flow, that's helping improve the relaxation state and so forth of the body. And in doing that, if it helps the organs, great. But the real idea is it's improving the overall functioning of the body, which will improve peripheral neuropathy. We've shown that. There's multiple studies showing that massage works. Reflexology is a specialized massage technique where you're focusing on certain areas for certain situations. And it's actually designed based on looking at the feet and saying, okay, are there any abnormalities in the skin that would indicate this might be an area of problem? And you treat that area. But in this study, they even found that in individuals that didn't have these clinical signs on the skin, they could also improve it from using the technique. So I believe reflexology can work if it's done right, and if you can actually massage, it can improve peripheral neuropathy. It's been shown in studies to improve peripheral neuropathy symptoms and so forth. Why it works, I can't tell you, but it does work, so it is something you can consider. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget Day 347, Reflexology for Peripheral Neuropathy. If you'd like additional information, additional options, things that you can actually do for your peripheral neuropathy, reach out to me at the neuropathywebinar.com, and you can join us for that webinar. You can actually ask questions, but we'll walk you through the process of some of the things you can do to manage your peripheral neuropathy. Thank you, and have a great rest of your day.